In regards to salary, in California, the average annual salary is 62,548, but it can also expand to 93,915. It just depends on the district. If you decide to work private or versus public, if you decide to unionize or not, that also plays a factor. Something else to note is that usually when you're working as a full-time nurse, you are having those standard benefits that include medical, dental, vision, life insurance, pay time off, retirement plans. There is also a possibility of additional pay depending if you have higher level degrees such as a master's or doctorate, as they may prefer that in certain districts. Something else to consider is the number of positions available. So across the U.S., there is about 74,000 nurses nationally, and which in most states ends up being 45,000 as well. So in California in particular, there is one nurse per every 2,400 students, which is significant because there is a lack of full-time nurses in California. About 57% of the districts do not have a full-time nurse. So the student load per nurse is inconsistent, and that can possibly add additional stress. Something else to consider is the workplace environment. So as a school nurse, you're working a lot, usually on your own, away from possibly other staff members, and also you're the only healthcare personnel there. So there's a bit of an isolated environment, but you can also have lower student ratios in that workplace environment depending how big or small that district is. So there's a possibility that if you want to work with a smaller student ratio, you may opt for private school settings where there is more resources or more flexibility and usually less students as well.